Physician working in Kothari Hospital, Kolkata. Today's topic is asthma, and as you know, being a chest physician, we have to see a lot of people suffering from asthma. Then the problem with asthma is ever so increasing, and I will give you a data which is from 2004, and so it is the statistics say that in India we have more than 20 million asthmatics, and it is increasing every year. Due to a lot of reasons, one of them is air pollution, environmental pollution, mainly air pollution, and it has got several complications, one of which is loss of work hour, morbidity, that's the patient's suffering, and also there are about 250,000 deaths all over the world every year. And so it is a major problem, not just for India but for every country in the world. So when we talk about asthma, we need to know what asthma is, and what I say to my patient is that it's a conglomeration, it's a combination of plenty of symptoms, and the important of them are chest tightness, wheeziness, shortness of breath, cough, etc. And it can be associated with runny nose and sneezing. And so if we see a patient with only sneezing and runny nose, we always ask for symptom of asthma, and we do a test which we call spirometry or a blow test to see if there is any evidence of asthma along with what we call allergic rhinitis, or in other words the nasal symptom. When asthma affects somebody, what happens actually, the airways is inflamed, and by inflammation I mean there is swelling of the airways from top to bottom, and once your airways, the inside of your airways is swollen, that means the caliber, the diameter of your airways is narrowed, and therefore you have difficulty in breathing. So we have to get rid of that inflammation, and for that we have several medication, and all of you know that for the last 100 years the asthmatics were taking tablets, etc., but we have moved on from there, and the inhalers nowadays are the mainstay treatment of asthma, and there are plenty of reservation for using inhalers in my country. I will give you some examples which are all myths. That inhaler is very bad for you, inhaler is addictive, which is not at all, and if you take inhaler no other medicine works, which is also a myth. It is not true, and inhaler has got plenty of side effects, and this is also completely untrue. I give one example to my patients when they say that this can be addictive. What I say is, if you brush your teeth every day, are you addicted to your toothpaste? If you use soap every day, are you addicted to soap? We never bother about checking the chemicals inside a soap, but we are very bothered about inhalers. And let me remind you that the inhalers they all have been tested thousands of times, and thousands of articles have been published in the peer review journals, which have been criticized, which have been thoroughly revised by so many thousands of knowledgeable doctors all over the world. So be careful about those myths and listen to what your doctors say. I say go to internet and read from well-known sites like Indian Chest Society, like American Thoracic Society or British Thoracic Society guidelines, and see what they say. Uh, Once you have been diagnosed asthma with all the symptoms, let me tell you before I forget that asthma can be manifested just with cough. So I quite often hear my patients say, no, I don't have asthma. I am not breathless at all. Nobody in my family has got asthma. I just cough. And let me tell you that only cough can be the manifestation of asthma. And so please don't be too worried if your diagnosis is asthma, because you can be as fit as a normal person and you can do whatever you want to do. You can go to mountain climbing, you can play football, you can do anything in life that you want. So this is about cough and the symptom. So what is the treatment of cough and how to stay away from doctors? Few things, the very easy things, is that to listen to doctors what they are saying and take inhalers regularly. And the common mistake, and very common mistake, is that we stop and start the inhalers. Whenever we are bad, we take the inhalers. Whenever we are good, we stop it. And that is not how we treat asthma, because we are submerged into an atmosphere which causes the inflammation in asthmatics. And so unless I take you away from your surrounding and put you in a surrounding which doesn't affect your body, you will remain asthmatic with symptom, and therefore you will have to continue with your treatment irrespective of whether you are good, bad or indifferent. So this is very, very important that you take your medicine religiously and regularly, even when you are good. And let me tell you something, the the dose of inhalers is so minute, it's in microgram instead of milligram, and I will come to that if I remember later. So in microgram dose, the inhaler, the side effect of inhaler is minimal, if at all. And you have to think of untreated asthma complication, and it's severe complication if you leave chronic asthma untreated, because it can go into what we call COPD, or chronic obstructive pulmonary disease, and it can give you several other complications. And so please do take your inhalers, do listen to your doctor's instruction. When you take inhaler, you make sure that you have been instructed as to how to take inhalers. Let me tell you something, that for inflammation, to get rid of the inflammation, we use anti-inflammatory, and the best anti-inflammatory under the sun as of today is steroid. And please don't be too worried about this steroid, because what you think and what you have heard, that steroid has got a lot of side effects, and I agree with you. But when it comes to inhaler in micro mini dose, the risk is so small and the benefit is so large that we really are not bothered using steroid to every asthmatics in the world. So and this is the mainstream treatment, not just in India but all over the world. The one thing, one note of caution is that when you take the inhalers, most of the time we take the pumps or the meter dose inhaler. Please don't forget to shake it before you start using it, because otherwise the medicine actually floats onto the surface, and if you do not shake it, it will not be a uniform suspension. So therefore you have to shake it well, about 8 to 10 times, vigorous shaking before you take it. And if it's a steroid inhaler, please do use a spacer with a valve, and there are several spacers in the market. Please use a spacer with a valve, or every time you use at least the steroid inhaler. And after use of steroid inhaler, please do rinse your mouth, gargle and spit it out. And I ask the patient to have a sip of water after each use of steroid inhaler. So this is regarding steroid inhaler. We have got plenty of other drugs. If you have allergic rhinitis with asthma, which is pretty common, Allergic rhinitis is when you have runny nose, sneezing, or nasal congestion all the time, or seasonally. Then the same medication, that's the steroid, which we cannot give you via inhaler for your nose, we use a separate device called nasal spray, and you have to take the nasal spray regularly as well, because it's just the upper end of the same tube, the respiratory tube. Your breathing pipe starts from your nostril and it goes down to your chest. So do not forget to treat the upper end of the respiratory tube or the breathing tube through the nasal spray if you have symptom of nasal allergy, or in other words allergic rhinitis.